Good afternoon. Thank you for joining us today. We would like to, before we start, like to take this opportunity to discuss a little bit about our new chapter of the MedTech program. Myself, Mina Chang, I'm with Bureau of Health Service Research with Ohio Medicaid. I'm a section chief overseeing the program development and MedTech project. We, the MedTech program has gone through a significant change this year. Moving forward, we are very unlike the traditional MedTech program. Many of the faculty that participating today perhaps used to be the recipient of the traditional MedTech program. We are be able to utilize the GRC's assistance to help the state in terms of program development, program planning, as well as the project management. There are new areas that Medicaid will be very interested in, including some of the larger program initiatives that Dr. Crane Ross mentioned earlier. We are also very interested in expanding the capacity in the rapid consultation and technical assistance. So getting started, I would like to introduce you some of the current interests and priority. Earlier, a couple months ago in April, our Director McCarthy was able to meet with the Academic Medical Center Advisory Council, talking about some current initiative that we would like assistance from MedTech. The number one priority, and this is very different from the traditional MedTech program, is a workforce development for Ohio Medicaid. The ideas, we are welcome new ideas. It can be taken in a format that like traditional internship, utilizing medical colleges, professional schools. But we are also interested in establishing partnership to stimulate students, medical student or non-medical students' interest to serve Medicaid population, especially in the area that's with shortage, such as primary care and psychiatry. And the idea is also including that encouraging the student before they graduated, they will be able to practice in emerging healthcare models that prepare students ready to serve the Medicaid population. One example would be such as health homes, working with the residency training program to bring medical students in the practice setting. And also we are interested in developing internet-based continuing medical education opportunity for our Medicaid providers. Another program area that our directors would like MedTech to involve is consumer education for Ohio Medicaid consumer. As you are aware, our Medicaid consumer a lot of times are with challenge to navigate the healthcare system. On average, their reading level is like third grade, and some are coming from a very diverse cultural background, ethnic backgrounds, and some do have language barriers. So we'd like to work with you to engage university departments to help us really assist educating consumer about healthcare and as well as healthcare system. And also helping us eliminating language barriers. Throughout the site visit that Dr. Crane mentioned earlier, we come to realize there are a lot of resources among university that's already been established on the health literacy. So we would like to use this opportunity to link those existing resources that might be currently underutilized. This next slide I'd like to bring to your attention is this quality strategy is relatively new. GRC has sent a draft document to you prior to our webinar today. When we did the site visit around the states, this documentation has not been made available. So we'd like to use today's opportunity to introduce you the Medicaid quality strategy. This quality strategy will be an overarching guideline for the next several years regarding to the Medicaid quality focus area. And we'd like to introduce you today some of those subject areas. The document you have received, it has a hierarchy, if you will. It started with this is quality strategy is based on a national quality strategy, so a lot of area that is probably not new to you. It should look very familiar to you, in fact. The top triple aims, the top is hierarchy is focusing on to improve better care, improve healthy population, healthy people, and also based on a best evidence and science-based practice to improve care. And under this big umbrella, we have identified 5 priorities area to really improve health outcomes and increase effectiveness of care. And under each of the priority area, we also have established goals to allow Medicaid focus on the next 3 years. And there are specific clinical area that we will go into a little bit detail in the following slides. And we also would like to talk a little bit about the initiatives that currently is either developing or underdeveloping to help Ohio Medicaid achieve those goals. So those are the quality strategy priority area. The first focus will be making the care safer, and we're also interested in improving care coordination. The third area is promote evidence-based prevention and treatment practices. And we are also focusing on supporting person and family-centered care. And the final area is to ensure effective and efficient administration of the Medicaid program. Under those priority area, we also have specific clinical focus. And if you are following the budget within this new administration, you're probably fully aware this administration is focusing, have a lot of emphasis on high needs, high cost population. So we have identified, based on the Medicaid data, those specific clinical focus area that is non-institutional level of care, and we focus on the most costly 5% cover family and children and age-blind disabled population. The top priority clinical focus area is high-risk pregnancy and premature birth. And we are also very interested in behavioral health, cardiovascular disease, diabetes, asthma, upper respiratory infection.